usually what you want to know when you have a vaccine is whether it's safe and whether it works. And typically that's done by giving the vaccine candidate to hundreds, if not thousands of people, and then observe them over a reasonably long time to see whether it's, both safe and works. Um, but essentially, whether you get a side effect from a vaccine like a headache or a mild body ache or even a fever, and whether the vaccine elicits the right immune response are all controlled by the genes in our body. And it's by looking, therefore, at what genes are switched on and off when you after receiving a vaccine, we'll be able to know very quickly whether one, the vaccine is safe, and two, whether it'll work the way we think it'll work. And if we do that by looking at genes, which are a lot more objective and more accurate, then we don't need to put any candidate vaccines into hundreds and thousands of people. We can do this with a lot fewer. And if with fewer people, we can do it much faster as well.
Okay, so let's talk about how much faster by looking at the genes, because normally I know it takes about a decade, plus minus 10 years or so, for any vaccine to go from discovery to clinical application. By using your process, going down your track, looking at the genes, how much does that shorten that whole process?
Well, when we did the study with yellow fever vaccine, we looked at it over a 6-month period to know whether it elicited the right kind of antibodies to protect against infection, and what side effects these people reported. Actually, you can get the same answer by looking at the genes within 5 days after they receive the vaccine. So you actually don't technically need to observe for 6 months. Now, obviously, in any clinical trial, you still have to go through that process and get the full set of data. But in an emergency like the one that we're living through, then by getting earlier answers, that gives the regulators confidence that this vaccine is on the right track, and we can still proceed to the next stages without finishing, the whole 6-month observation, for instance.
Doctor, the World Health Organization says that the earliest a vaccine will be available is sometime in 2021. Do you believe that the work that you're doing now alongside your international partners will be able to speed up that process and possibly deliver us a vaccine sooner rather than later?
Well, I mean, I guess that's what everyone's hoping, that we can, move this along as fast as we can. And the reason for that is because we're living through a crisis. Where, the path forward is always a little bit uncertain, especially when we're dealing with an unknown disease. We're hopeful that by the end of this year, we'll start clinical trials, if not beginning of next year. And I think once we show that the vaccine is safe and that it generates immune response, then in a circumstance like the one that we're living in, especially if the number of cases continue to climb, then we can use the vaccines in ways to both test its potency, but at the same time start to protect people. And we just have to be very creative at that point in what can be done. And I'm optimistic that I think by next year we'll be able to see some of this rolling out into various phases to protect the community.
Absolutely, Doctor. You have to be optimistic in this environment, I think. When you look to the future, though, has there been anything about your study of the coronavirus that has surprised you? And what can the human population do to protect themselves against other viruses of similar characteristics in the future?
That's a great question. I think this question should have been asked 20 years ago. And we've lived through several pandemics now. I mean, well, epidemics to the scale where it's happened in various continents, such as SARS, such as Zika. I think we need to be prepared, and that's the fundamental message, that we cannot wait for an outbreak to occur and then we respond. And that tends to be the case, that when nothing is happening, then research or healthcare resource is always directed elsewhere to tackle other problems like cancer and heart disease, and infectious disease are quickly forgotten. And I think we hope, I certainly hope that, coming through this COVID-19 outbreak, once we're over, that we don't forget what it's doing or has done to us, and that we'll continue to support the kind of work needed to prepare for the next one, and the next one will come, unfortunately.